Pat's doing here, but we're going to do it. We're live on YouTube, live on Facebook, live for our own clients on Facebook. And it's 12:30. All right.
Okay.
Here we go. Hi, everybody. Welcome to the WoofWoof MeowMeow Vet Advice Podcast. I'm Kristen Carlson. We're here today, and we've got a lot going on today. Dr. Jim Carlson is here with me. You can see his work on a whole ton of different places, including where have you been lately? Oh, you're going to be in U.S. News and World Report.
Yeah.
Talking to them about the education of veterinarians. Going to be, you've been on rover.com lately. You've been on... No, we're not on that one yet. We're hoping for that one. Don't announce that yet.
I love Martha Stewart.
I know, I love her too. I just wish she'd let us in her magazine.
Yeah, yeah, I know.
We'll have to see how that goes.
So I planted the seed there, maybe.
Yeah. Start manifesting it, dreaming it.
Yeah, that's right.
So rover.com, Pet Coach, Petco. Well, Pet Coach is a division of Petco, so you've been in that one too. Yeah, lots of different things. And PetMD, which was pretty cool to be in as well. Yeah. Okay, so a lot of things are going on this week with pet-related news. One, the company Blue Buffalo makes diets that are inspired by the diets of ancestral canines, but now they're facing a $5 million lawsuit. Wow. This is from a pet owner who alleges that the food she fed her pet gave it obesity and diabetes. The bone of contention here is the pet owner's claims that the Inspired by Pet diet is full of carbs and that wolves didn't eat those in the wild. So I don't know what kind of claim, she's really making here. Obviously, your pet's medical condition is between you and your veterinarian.
Yeah, there's a lot of factors that are related to pet obesity. Even grain-free type diets can cause weight gain if you're feeding too much food. So if you're overfeeding them, those extra calories go on the body as weight, mostly fat, because it's trying to buffer inflammation.
Well, her contention is that it did have carbs in it, too many carbs that wouldn't be found in the wild, but it wouldn't matter either way. I mean, you still have to be responsible for your pet's obesity.
You do. It's not all just the dog food. Yeah.
So I don't know. I guess we'll see. This is a class action lawsuit. So this is kind of a big deal. And I think kind of one of the first times any pet owners have actually tried to sue a company over the claims that are on the bag or anything like that.
And I could see it happening. I mean, if they were making, like claims that it was all ancestral grains and then you had corn in there or something. I mean,
that would, depends on how far back the ancestors were.
Right. I mean, you can't make wide claims and think that, sooner or later someone's going to speak up.
We do carry an ancestral grain.
Yeah.
I mean, farro, this is by Farmina. They do have some different foods that have ancestral grains in them, like farro and other stuff I'd never recognized or knew existed.
Yeah.
It's good ancestral.
Yeah, they were back during biblical times.
Yeah. And I'll pull you back here just
sorry.
Bit. Scooch back.
I'm
there you go.
There.
Just a little, well, not that. Yeah, scooch that far. There you go. That works better.
Can I lay back?
No. The FDA says it can't find a scientific link between dilated cardiomyopathy and grain-free foods. If you're like a lot of people who switch to grain-free diets, it's possible that you've heard about the potential heart implications that cropped up about a year and a half ago. The FDA started an investigation in July 2018 and included these brands most frequently named in cases of dilated cardiomyopathy. So those are the following: Akana, Signature, Taste of the Wild. There they go again. Yeah. For Health, Earthborn Holistic Blue Buffalo, Nature's Domain, From Family Foods, Merrick, California Natural, Natural Balance, Origin, Nature's Variety, Nutrisource Nutro, and Rachel Ray Nutrish. The FDA's latest report says more research is needed on the potential link between certain diets and cases of dilated cardiomyopathy. This is also called DCM. And what is this exactly?
Well, you get a dilation of, typically the left side of the heart, which is the more muscular side of the heart. And when that starts to thicken, the heart chamber gets smaller. so it's not pumping enough blood out.
Oh, does this sound differently?
You may or may not have a heart murmur with dilated cardiomyopathy, but usually the pet's symptoms and an X-ray, the heart's obviously larger when you do a vertebral heart score, or you have a cardiac ultrasound. You can tell that the chamber of the heart is smaller and the width of the muscles are thicker.
So what would be the symptoms of dilated cardiomyopathy?
Sudden exercise intolerance or exercise intolerance over time, coughing in the morning, vomiting and or diarrhea. And usually that cough is going to be in the morning, first thing when they wake up. It's like a smoker's cough. They're trying to clear the throat, and it's really it's called a frothy cough. It sounds watery versus just a dry cough.
Okay. Do they get like bloated and stuff in their stomach? Do they retain water?
More advanced heart disease, they do. When the heart's not working like it's supposed to, not getting the blood out, the blood gets backed up in what they call the venous return. So a lot of that, obviously, the blood can't pool in the abdomen, but the lymph fluid can back up into the abdomen to make room for more blood because it's not going through the heart fast enough.
Okay. So how is this all related to dog food?
Well, it kind of started back in the around the 1970s with cat food, and they realized that a lot of cats had heart problems in it, and they discovered that it was related to taurine deficiency. There wasn't enough taurine in the diet, and so when they started putting taurine in the cat food, then all of a sudden all these heart problems went away or greatly reduced. So there's some concern that, well, if that happened to cats, could it happen to dogs with all the newer grain-free diets out there? But the jury's out, because cats aren't small dogs. They're different. They have different needs than dogs do. But as a consumer, until the research is definitive, I wouldn't necessarily not feed the dog.
Okay.
And I wouldn't necessarily add more taurine to the diet.
Okay. All right. So this is caused by a taurine deficiency, or is that just one part of it?
That's one part of it that they're claiming. So there's probably some vitamin deficiency or amino acid deficiency.
Can you reverse it by just taking them off of it and feeding a grain-free or a regular food with grain?
Yeah, probably.
Oh, okay.
I mean,
so sometimes you can. Right,
because the grain diets are going to have more taurine in it than just meat-based foods. And the reason the cats had issues with that is the refined protein. They can eat more protein and a higher protein diet than dogs, but at the same time, if there's not added taurine in the protein, then it can cause some problems related to it.
Okay, alrighty. What are people supposed to do at this point? What is your big recommendation that people have with this?
Well, just stay consumer conscious. Check the reports regularly. But would I immediately go out and switch brands of food? No.
Okay.
Yeah.
All right. So you're still prescribing that food?
I am.
Grain-free food.
Yeah.
Still doing it.
Still a good idea.
Okay. All right. It's a great time to get away, and more people aren't leaving their pets behind. With the snow coming this weekend, it's very tempting to hop a flight to Florida. A few simple questions for you about pet travel and the paperwork associated with it. So if you're driving somewhere with your dog, say, I want to go to Iowa, do I need a pet health certificate?
If you're not moving there and you're just going for the holiday, no. Because frequent travelers outside of the state that want to take their dogs, they're not staying long enough really to warrant any problem with health. But you do want to have your health papers with you, not necessarily a health certificate, but have, make sure your pet's examined once a year. Make sure you have your most recent copy of your health records with you. So your vaccine records, that kind of stuff. Yeah. In case you're staying in a hotel, like you mentioned, that maybe they might ask or something like that.
Mm-hmm.
Yeah.
You never know. Okay,
Right.
so what if I'm going to like taking my car and I'm driving to Texas from here? So should you maybe consider getting a health paper for something like that? So you're going to multiple states. You kind of don't know who you're going to encounter, and
Yeah.
do hotels require that?
It would be a good idea if you're going to go further than one state, just in case, because the weather can change and you might have to take a flight back.
That's true.
And they different states may suddenly change their requirements, but probably the biggest factor if they had to suddenly take a flight back for an emergency and they don't have their health papers.
Oh, all right.
So if you're gonna like the next state over, it's probably not going to be as big a concern about getting back right away. You can usually drive fairly quickly, but flying that or driving that far away to get back fast is
you just don't know.
Yeah.
Okay. All right. So if you're flying, what do you need to have with you?
You should have a interstate health certificate.
Okay. What is involved in that? What do you have to do to get that?
And you go to have a health exam by your veterinarian.
Okay.
And they fill out a health form that is who you are and your address and where you're going, and the address of where you're going. You need a vaccine. It'll contain the recent vaccinations, especially rabies, and a signature by the veterinarian. You do not have to be accredited to sign that form necessarily.
Who doesn't have to be accredited?
The veterinarian, if you're just going to sign an interstate health paper.
Okay. So there's an accreditation process by the USDA, and a lot of veterinarians have it. You have to do it to do federal type forms, correct?
Correct.
Okay. So if you are going internationally, you have to have a USDA accredited veterinarian. Correct. You are USDA accredited.
I'm USDA accredited, and that's a more complex because every country is different. You want to prepare at least 6 months in advance.
Oh yeah, it's serious stuff.
Yeah.
And then sometimes like we can't help you because we don't speak the language, so we have to really ask you guys to get everything that we need to be able to process your paperwork, because every country's different. They all have so many different things, and like I think we had somebody who wanted to get a rabies shot one time, but it had to be a certain amount of time before they could travel that they got the rabies. It was just like everything's different. It's so crazy. And then trying to navigate an international phone call with somebody's health department is so hard. You may not speak the language, that kind of thing. So if you can like prep everything first, that's great. Help us out a little bit by telling us exactly what you need. And the airlines actually have become kind of easier to deal with because they're all set up for this now.
Yeah.
And they have like downloadable documents. So those actually are going pretty well.
Yeah, internet has made it
easier than it used to be. At least for us, and then for the pet owner ultimately.
Right. And you have to have a state veterinarian sign the international health papers.
Okay.
And there's typically, and like the interstate, there's 4 copies. That have to be distributed properly. And the international papers are the same way. There's 4 copies.
Okay.
But make sure that that's why you have to plan enough ahead of time make sure the state veterinarian signs it.
So if you want to take your dog next week to some other country, it's probably not going to happen.
Well, not going to happen that soon.
Yeah. Unless you already have the paperwork done.
Canada's probably all right.
What if you're going from like a cold northern state to a warm southern state? Are there some health things you should consider?
Yeah, if there's at least a 30-degree difference, like in Florida, what did they say? It was 71 today.
Our daughter just moved to Florida. She's riding horses down there.
Yeah.
She's still going to college a little. So she's having the time of her life.
She is nice and warm down there, but if we were to send one of the dogs down, it's been cold up here and they got the heavy winter coat, probably a good idea to shave them or have them stripped down, cut shorter.
The undercoat and everything out. And you need some flea and tick medication, probably.
Right.
Heartworm.
Yeah. Make sure they're on heartworm prevention. Probably plan on doing flea and tick. That way, when it's warm down there and you come back, you can always put a coat on. Make sure that they have a little coat to come back with because they'll get cold. But but they can't thermoregulate like we can, so they can't sweat and cool down. They have to adjust themselves internally, so that extra heat can cause a rash and upset tummy and all that kind of stuff.
And even the horses that they took down to ride the place where our daughter works had to go down there, and even the horses had to just go down and rest for quite a long time because it was just so different.
Yeah,
so hot compared to how cold it was up here.
That's a good point. Don't plan on doing just heavy exercise down there.
Not with the dog anyway.
Right.
Do it yourself.
Yeah, exercise yourself, but don't run them on the beach really hard.
It says 2 million people are traveling by air in the U.S. with their pet, 4 million internationally, and 37% owners plan to travel with their pets. That is billions on pet travel. And motels, hotels, they're all getting onto it because they have actually plenty of animals who are being included in hotel rooms, accommodations. They're even on the brochure. So they're ready for your dogs and cats to come with you on vacation.
I was talking to my, he's a pilot for the airlines, and he said that many more travelers for anxiety pets are increasing.
Oh, really?
So people and he said they'd come on with all sorts of animals. A python, he said one time, was an anxiety pet, so.
Oh.
And
I would want to sit next to that one.
Right.
Yeah.
Just made him, so I could see where the hotels would accommodate more for anxiety travel, because pets make you feel better, I guess, when you're traveling, right?
Yeah, I suppose. Oh, there is one other thing you would need to know. It's actually right there. Could you hand me that brochure? The one in your hand right now. Yes, that one. So it's the crate. Okay, so not every pet's gonna fit underneath the seat. Okay, so you have to have a crate this is according to the AVMA, and they have a really nice pet travel brochure that's actually on their website, theavma.org. That's what this is. Came from there, right there. And it says the crate has to be large enough to allow the animal to stand without touching the top of the cage, sit erect, turn around, and lie down in a natural position. Latch securely, be strong and free of interior protrusions with handle or grips. Have a solid leak-proof bottom, plenty of absorbent material, and be appropriately and clearly labeled with all of your info, as well as a designation of live animals with arrows indicating the crate's upright position. Okay, so obviously, there are some concerns when you're sending your dog on an airplane, especially if it's hot. I mean, in Florida, it's been 90 degrees in the last week, as farther south you go. And that's always my thing about like traveling with my pet. I'm like, I just don't want to take that risk. I don't know how long you can sit in a situation like that in the airlines, but I think they're getting better at it.
Yeah, they have requirements between, can your pet handle temperatures below 45 or above 80 degrees for a period of time.
Okay.
And for short periods of time, they could handle that, but not long, But the airlines are very good in keeping that temperature under control because they don't want problems.
Well, I would never, I don't know, it's just me, but what about a brachiocephalic breed? And those are the breeds with the nose that's pushed all the way in, like the pug, bulldogs. What else is brachiocephalic? Like
the Boston Terriers and boxers. But you want to make sure that they're healthy enough for travel and that they tolerate being in a carrier fine. Because if they've never traveled in a carrier before and then they're suddenly asked to be in a carrier on an airline that they haven't flown before, it can cause a lot of anxiety.
Totally go crazy.
And you can't really sedate them on the airline because
you can't.
The temperatures and the pressures are so different that there could be some problems with that. So you kind of have to practice traveling with them. And if they're not good travelers, going to a
plenty of places to stay.
Yeah, pet resort and have a mini vacay.
They can have a lot of fun at a pet resort now.
Yeah.
So, all right. Well, we are moving on now to top reasons for veterinary visits. Nationwide Pet Insurance lists the top reasons for the visits for cats and dogs. And there are some similarities in the two species, but not until you're about halfway down the list. They're very, very different. The top reason for cats to see a veterinarian is bladder or urinary tract disease, typically seen in litter box problems. And for dogs, skin allergies are the really big issue and the biggest challenge to treat, honestly, in the animal hospital. Conventional treatments are steroids and antibiotics, and there are many things to try holistically. A lot of people want off the steroids and antibiotics wheel, and that's something that we try to do, but skin is very, very difficult to treat.
There's so many different reasons for
Like
itching. They can have neurologic itching. So it can be due to the nervous system acting up. It can be due to the hormone system acting up. It can be due to food allergies and leaky gut syndrome.
Lymph glands. You've seen
glands,
like a chain of lymph glands will become swollen or irritated or something.
Yeah. The classic seasonal allergies, can cause a flare up. Genetics, like atopic dermatitis, a genetic dermatitis. But even liver, kidney, heart disease can cause flare-up dermatitis as well. So just itchy dogs it's such a general term that there can be a lot of underlying problems.
Oh, okay.
That's why it's so complex. And,
it's really hard. So how do you go about an itchy dog? We're just going to take number one from each list here and talk about that a little bit more. Okay, so I've been involved with all of your cases, well, a lot of them, on itching, scratching. First of all, the owners, you have to feel really bad for them. They feel bad for the dog, but then the sound of the constant itching can really drive someone crazy.
Yeah, because they're usually scratching at night, and early in the morning. And
how do you break it down? How do you start? When you're looking at this, and we get a lot of second opinion cases all the time, many of them involving skin, and honestly, the steroids antibiotics cycle. But how do you break the whole thing down? Where do you begin when you have a skin second opinion?
There's kind of three sections. One is the disease itself, and how chronic it's been, how many meds it's been on. If it's a fresh case, a lot of times we're starting with maybe just a short-term anti-inflammatory. It's not steroids. It's not that steroids are wrong. It's just they're used too long. No more than 2 weeks. On a correct dose, they can get magic relief. If it's going to be longer than that, considering Apoquel, which is more long-term therapy. But again, it's medication. There's side effects, So the second part is that we have to look at the pattern. As I mentioned earlier, what's directing the itching? Is it a behavior problem? Is it a GI problem? So we look at nutrition, we look at exercise, and they're on an appropriate herbal supplement for that. And with biofeedback, we get to the root of the problem. What was the initial trigger that's still with them that acts as a trigger? And the analogy I came up with is, when you were a kid, they'd say you had the flu and you threw up bananas.
Okay.
And then later on, you can't be around banana cake. You can't see the color yellow because it makes you feel like they have the flu. Well, why is that?
My sister's that way with barbecue potato chips.
Yeah. So why is that? Well, it was programmed in as a reminder that you're getting close to the flu again.
Okay.
So there's triggers that cause the symptom of scratching to come out, even though the allergen is not even there. Okay, so you have to address that as well.
And people shouldn't just jump to the food allergy thing.
No, that's a very small percentage of the problem. Food can be, if they have leaky gut, then food's an issue. But I've had dogs on raw food that are scratching like crazy.
Okay.
So it's not the diet, and not always food allergies. I think food allergies may be a secondary problem, in my opinion.
Oh, really?
Yeah.
I think a lot of pet owners jump to that first.
Yeah, it's most popular, especially with when the skin is more chronic and they're not responding to steroid or antibiotic. Often the next step is a food allergy from a more conventional approach. But to me, that's a long road, because you're doing food trials and it may be hit or miss to find the right diet. So, and then often they relapse. So more sustainable is you have to treat the patient.
Okay.
You have to remember the patient's able to control it themselves. We just got to guide them back to where they weren't scratching.
Okay.
Yeah.
We had, there is a really, really good food that it takes the protein down, the Royal Canin one.
Yeah, I like
takes the
that one.
protein and they've spun it out of the chicken feather into basically a microparticle. Is that kind of, am I on the right wavelength here? And when they do that, it's like a basically easy to digest protein that's supposed to make your pet's skin better. It's just a temporary, like you have one bag, you do it for like 30 days, and then you start stepping down a little bit. It does have corn. I literally had people say, I'm not doing that. It has grain in it. But, it's a good start conventionally too for a lot of people.
Food is medicine. And even though some of those prescription diets have grain in them, it's like any other treatment. The goal is not to have them be on it long term, like forever. You want them to eventually have, be back on a regular diet.
Okay.
But that hydrolyzed protein works really, really well. If you want to take the food out of the equation, have that on board while you're treating them, because.
All right. So cats, their top number one reason, bladder or urinary tract disease. So
that's a big one. Yeah.
Yeah, well, it's a huge one for cats. And tell us, like, of all the patients that you see, I feel like fewer of them have a bladder or urinary tract problem than they do a litter box problem.
Yeah, it's complex because once it gets hardwired into their head, and suddenly they think the bed's the litter box. It's really hard.
Something else or middle of the floor. Yeah.
And it's hard because the first step in controlling that is you have to remove them from the environment they can't handle for a while. So the hardest concept for owners to think about is I often tell them, get a very large dog kennel and give them an apartment for a while, so you can monitor their urine output and make sure they're going in the litter pan again. And it's called reacclimation. But owners have a really hard time with that because they say, well, I'm confining my pet. They're going to be caged. They can never come out of there. I said, no, it's only maybe 2 to 4 weeks. So if you want to keep them at your house, you can maybe try a rehoming reacclimation at another home to kind of break the cycle. Or at your vet office, have them stay there as a boarding for a while.
We had to do this with Twitch.
Yeah.
He was our office cat for many, many, many years. That big, huge kitty that used to sit on the front desk. And he came in to be euthanized, but he was so cute. It wasn't going to happen. So he was young, I think 7 at the time.
Yeah.
Something like that. Anyway, he had to be left in a cage to learn how to go appropriately. And he never really did, he didn't go around the hospital doing it, so that was good.
Yeah.
He still went in his blankets sometimes, which was gross, but he did get over it because we had to confine him for a certain amount of time. And that's your cage. That's where you go to the bathroom. That's it. And he did eventually learn.
Yeah. And so once you're confident that they're using it again.
What if it is a real UTI? How do you determine that? Urine testing?
The best is urine test to see the urine pH.
Okay.
If your kitty, won't go to the bathroom and give us a sample by cysto, then you can get the litter, the pH litter to tell you.
Okay.
If they have a high pH and then the urinalysis shows there's bacteria, more female cats get a bladder infection. Male cats get cystitis. But it's called feline lower urinary tract disease.
Okay. But that needs testing, right?
Yeah, the best is to see a vet and get a urine test.
All right. And one little quick tip before we go. What do you do about salt and snow on the ice? Because the salt and snow is coming this weekend. We do carry some balms. The two we carry have CBD in them. They're really nice. This one's a little stick. You can swipe it on your dog's paws, keeps them nice and clean, rinse them off when they get back in the house, or use a baby wipe on them.
Yeah.
Be your quick tip for today, right?
Right.
All right. Well, thanks for joining us, everybody, for our podcast. We'll see you next Thursday. Take care.
Bye-bye.